A new study tracking the dietary habits and cancer outcomes of more than 1.8 million people over an average of 16 years has produced findings that are generating significant attention in the nutrition and public health community. Published in the British Journal of Cancer, the research found that vegetarians tend to have a meaningfully lower risk of developing several major cancers compared to meat eaters. But the results were not uniformly favorable for plant-based diets. Vegans, in a finding that surprised many nutritionists and researchers, showed a roughly 40% higher risk of developing colorectal cancer compared to meat eaters. The headline number is striking, but the researchers and independent experts who reviewed the study were quick to emphasize that the full picture is considerably more nuanced than any single finding can capture. Understanding what this study actually found, why the vegan colorectal cancer result may be misleading as a standalone data point, and what the research collectively suggests about the relationship between dietary patterns and cancer risk, requires looking at the study's design, its limitations, and the specific mechanisms researchers believe are driving the different outcomes across dietary groups. The scale and design of the research. The study drew on long-term data from over 1.8 million participants across 4 countries, including the United States, United Kingdom, India, and Taiwan, making it one of the largest analyses of dietary patterns and cancer risk ever conducted. Participants were categorized into 5 dietary groups: meat eaters, poultry eaters who avoided red meat, pescatarians, vegetarians, and vegans. The study tracked cases of 17 different types of cancer over the follow-up period. An important characteristic of the study population is that participants across all dietary groups had relatively healthy eating habits by general population standards. They were not consuming high quantities of the processed meats like sausages and bacon that are most consistently linked with elevated cancer risk. A significant portion of the US-based participants came from the Seventh-day Adventist community, a group that considers healthy eating and physical activity central to their religious practice and tends to have notably better health outcomes than the general population across multiple measures. This means the study was comparing relatively healthy versions of different dietary patterns rather than contrasting optimal eating with typical Western diets. The cancer risk reductions for vegetarians. The most consistent and favorable findings in the study applied to vegetarians. Compared to meat eaters, vegetarians showed a 31% lower risk of multiple myeloma, a 28% lower risk of kidney cancer, a 21% lower risk of pancreatic cancer, a 12% lower risk of prostate cancer, and a 9% lower risk of breast cancer. These are among the most prevalent and lethal cancers, which makes the magnitude of risk reduction across these 5 categories a meaningful finding. Pescatarians also showed benefits, with lower risks of colorectal, breast, and kidney cancer compared to red meat eaters. Poultry eaters who avoided red meat had fewer cases of prostate cancer. The patterns across these groups consistently pointed in the direction of reducing or eliminating red meat as associated with lower cancer risk in multiple categories. Lead investigator Tim Key, a professor emeritus at the University of Oxford with decades of research on vegetarian diets, offered his interpretation of the mechanism. His view is that the differences in cancer risk between meat eaters and vegetarians are more likely related to something about meat itself than to vegetarians simply eating more fruits and vegetables. The differences in plant food intake between the groups were not dramatically large, but the cancer risk differences were meaningful, suggesting that compounds in meat that affect blood protein levels and organ health over long periods may be the more significant driver. However, the study also found an instance where vegetarians appeared to have higher cancer risk than meat eaters. Vegetarians had nearly double the risk of developing squamous cell carcinoma of the esophagus compared to meat eaters, a finding researchers attributed to potentially lower riboflavin intake among vegetarians. This serves as a reminder that the advantages of a vegetarian diet are not uniformly distributed across all cancer types. The vegan colorectal cancer finding and why it requires context. The finding that attracted the most attention was the approximately 40% higher colorectal cancer risk in vegans compared to meat eaters. Researchers believe the most likely explanation is calcium deficiency. Calcium plays a specific protective role in the colon by binding to free fatty acids in the gut and removing them before they can cause cellular damage. Lower calcium intake is associated with higher colorectal cancer risk, and Key confirmed that calcium intake among vegans in the study was on average quite low. This is where the temporal context becomes critically important for interpreting the finding. The participants in this study were recruited at least 10 years ago, and in some cases as far back as the 1980s. Vegan diets in that era looked considerably different from vegan diets today. Fortified foods, including plant-based dairy alternatives that now commonly provide substantial calcium, were far less available and less widely consumed by vegans decades ago. Key noted that more recent data he has reviewed shows no meaningful differences in calcium intake between vegans and others, largely because of increased consumption of fortified plant-based foods. This temporal gap means the elevated colorectal cancer risk observed in the study's vegan participants may largely reflect historical calcium deficiencies rather than an inherent risk associated with veganism as a dietary pattern. If today's vegans who have access to a much wider range of fortified foods and are generally more nutritionally informed about supplementation needs were followed for 20 to 30 years, they might show no greater colorectal cancer risk than meat eaters. Key said as much directly, the processed food problem cutting the other way. While the calcium story may explain why vegan colorectal cancer risk looks elevated in historical, dietitian scientist Nerys Asbury from the University of Oxford raised a different concern about modern vegan and vegetarian diets that cuts in the opposite direction. The study data reflects eating habits from an era when vegetarian and vegan diets were typically built around whole foods such as vegetables, beans, lentils, and pulses. Today, many plant-based diets include a growing number of highly processed meat and dairy alternatives, and the expanding body of research on ultra-processed foods suggests these products may not deliver the health benefits associated with the whole food plant-based diets of earlier decades. This observation introduces a complication for projecting current vegan health outcomes forward. The calcium problem that likely drove the historical colorectal cancer finding may now be largely solved by fortified foods. But the quality concern created by the proliferation of highly processed plant-based convenience foods is a new variable that did not exist in the population studied. Whether the net effect of these two shifts is favorable, neutral, or negative for future vegan health outcomes remains an open question. What the study does and does not change. Despite the complexity of the findings, the researchers were consistent in their view that this study does not overturn the fundamental dietary guidance that evidence has supported for years. Eating more vegetables, enjoying red meat in moderation, and limiting or avoiding ultra-processed meats remains the well-supported core of cancer risk reduction advice. The study adds nuance about the potential importance of micronutrients, including calcium, riboflavin, and B vitamins that are more readily available in animal products and that vegetarians and vegans need to obtain deliberately through fortified foods or supplementation. The dietary pattern that the full body of evidence continues to favor for both cancer risk reduction and overall longevity is something close to a Mediterranean-style approach, rich in vegetables, legumes, whole grains, and healthy fats from sources like olive oil, nuts, and fish, with moderate inclusion of lean animal proteins and limited consumption of red and processed meats. This pattern neither requires strict veganism nor endorses unrestricted meat consumption, and it aligns with what the new study's most consistent findings support across cancer types and dietary groups.